Well, it's been called a healthcare revolution. Next month, the country's largest HIV and AIDS campaign kicks off and will draw in ministers, retired healthcare practitioners and celebrities. The aim is to test 15 million South Africans and distribute 2.5 billion condoms. And it all comes with a price tag of 1.4 billion rand.
As possible.
The former president wasn't prepared to do it.
So the matter of whether I take an HIV test or not, I think is irrelevant to the matter. It might be dramatic and make newspaper headlines.
But in 2010, it's a different story.
National ministers, deputy ministers, provincial premiers and other leaders as like the MECs for health and their colleagues, as well as SANAG leaders, will take the lead and be the first to test.
It's said to be the country's largest ever testing and counselling campaign, using all government hospitals and clinics as well as every university campus. 4,000 retired healthcare practitioners have already pledged their assistance, and local celebrities are also jumping on board.
I think I have a responsibility as a parent, as a celebrity, as a woman of South Africa to say, I'm doing it first, are you?
We need to do our test, and the reason for doing tests is not to boast about it, but to save lives.
Government is hoping to test up to 15 million South Africans from 12 years and older by June 2011. Officials are optimistic even President Jacob Zuma will take the test publicly, a move that could only help encourage others to follow suit. Vanessa Govender, E-News, Johannesburg.
So it's all hands on deck for this project. We're now joined by Saul Kornik, he's CEO of Africa Health Placement, to find out if we have enough healthcare workers. Saul, good evening. Thank you so much for joining us. Can we pull this off with the healthcare shortages that we've had in the past?
It's going to be challenging. It's an ambitious campaign, and it's definitely an excellent step on the part of the Department of Health. But it needs to be coupled by a program to increase capacity for our human resources on the ground.
How are we going to go about increasing that capacity? We already know that the Health Ministry is trying to attract retired professionals back into the service.
They are doing that, and quite successfully as far as I can tell. There's partnerships they're trying to form with private sector healthcare institutions as well. Life Healthcare and pharmacy councils, I think Clicks is involved as well in that. So that kind of partnership, and it actually signals an excellent change in the part of government and how they're interacting with civil society and private sector to get a campaign of this size into action.
We're already seeing that the price tag for all of this, although welcome, is going to be 1.4 billion rand. Do you estimate that it might even go higher the more staff we attract back into the public healthcare sector?
Certainly, this is the first step to test and to do the counselling. Once we've tested 15 million people and an estimated 1.5 million people are tested positive, you then have to get into the treatment side of things. And that's going to be even more burdensome in terms of human resources. So certainly there's going to need to be a budget made available to bring those resources into the system to treat after the counselling and testing anyway.
I imagine if they're bringing in retired healthcare practitioners, many of them will have to be re-skilled and retrained.
Sure, that's quite possible. There are a lot of issues around the skills that are required for counselling and testing. From 1 April, nurses will be able to initiate patients onto ART, which is going to be an excellent change if they've got the training that's been stipulated. But the skills of the retirees are depending how recently they retired. The pandemic in South Africa has been going for quite a while though, so most retired nurses and doctors at this stage will have had experience in HIV and AIDS.
All right. A lot of healthcare workers left and went to work in places like Britain and Saudi Arabia, for example. Are we trying to get them back to try and help in this?
A valuable resource if we can. I think probably in order for nurses, for example, to come back from overseas, there'd need to be a change in the OSD around nurses and HIV. At the moment, the OSD doesn't recognize HIV as a specialty for nurses, and so nurses aren't encouraged to take up the HIV kind of line of things in terms of career progression. So if something like that was implemented, perhaps nurses would come back and get involved. But at this stage, I think probably a more valuable source of health workers to help administer this campaign and the treatment campaign that needs to follow would be the foreign health workers that are already in the country but not able to work in our hospitals because they aren't able to get endorsement from the government to work in South Africa.
Are there a lot of those health workers?
There are quite a lot of health workers from other African countries, and it's the government's policy not to poach health workers from other countries. And so that blanket policy has meant that a lot of African doctors and nurses aren't able to work in South Africa. We've seen a slight shift recently where certain foreign doctors who are married to South Africans or have refugee status are slowly coming through the system. But the government really needs to take a look at that policy and recognize the rights of the individuals who have come here to seek work, despite the fact that it means that their home country may be without their skills.
Is this something that Dr. Motsoaledi is perhaps looking at? Are they amenable to making that kind of shift as far as you're aware?
Dr. Motsoaledi has been amenable to suggestions from all sectors at this stage, and we've seen a shift in the last few months that we haven't seen for the last few years that we've been in operation. So that's been very encouraging. I'm involved with a number of projects where we're putting suggestions to the minister as to how he can deal with the politics around these policies, while at the same time providing the critical healthcare that's needed. And particularly in rural areas, because these foreign doctors that come into the country work in rural areas. A lot of the ways in which the Department of Health is going about bringing skills into the system in order to administer this campaign is bringing skills into urban areas. You're bringing back retirees, they're going to be retired in urban areas. The private sector operates mainly in urban areas. And there seems to be a lack of focus on how you administer such a campaign in rural areas, where management of hospitals is a lot weaker. Where you've got good management, perhaps the resources can be set aside to be done, but we know from our work in travelling to rural areas that rural hospitals are already very understaffed. And the foreign doctors that are allowed into the country almost all go and work in rural hospitals. So
often local doctors don't want to work in rural areas. That's a problem we've had in the past, isn't it?
Yes, I think it's fair though. If you grow up in an urban area and you've got the resources available for you to study in that area, you're not going to want to go to some foreign place, whether it be rural or perhaps even another urban area, in order to do so. But there are the solutions to dealing with this rural crisis that, to be fair, countries developed and developing all around the world have to face.
All right, so we roll this out in April. Are you confident we can pull it together?
I think that you can plan and plan and plan for something like this. You can plan forever. I think it's an excellent sign that they're actually just going ahead. And I think even if they don't hit their target of 15 million people by the middle of next year, even if they get 50% of that, it signals a significant change on the part of the government, and it also provides the Department of Health with very valuable information that they probably have lost out on over the last 10 years.
All right, Saul, thank you so much for your time and your insight. That was Saul Kornik. He is CEO of Africa Health Placement.